Welcome back to another Explainer. Today, we're going on a bit of a treasure hunt, but we're not crossing oceans or continents. We're actually exploring a fascinating anatomical map located right on your own body. We're going to decode a tiny space called the cubital fossa. If you've ever had your blood drawn or an IV placed, you are intimately familiar with this spot, even if you didn't know its fancy name. Let's break down its incredible architecture. So, what exactly is the cubital fossa? Basically, it's a triangular hollow situated right in front of your elbow. But I want you to think of this not just as a flat patch of skin, but as a real three-dimensional room. It's kind of like a little valley nestled right into your upper limb. It's a highly specific, architectural space with its own walls, a floor, a roof, and some very important inhabitants passing straight through it. Before we start laying down the bricks and mortar of this room, we've got to ask the big question. What makes this tiny triangular hollow so incredibly important in daily medicine? Why do doctors, nurses, and phlebotomists care so much about this one specific piece of real estate on your arm? Well, today, we're going to bridge the gap between textbook anatomy and a real-world clinical application that, honestly, practically every single one of us has experienced firsthand. Okay, let's dive into our syllabus for today. First, an intro to the cubital fossa. Second, mapping the boundaries. Third, constructing the floor and roof. Fourth, identifying the vital contents inside. And finally, the clinical significance of venipuncture. Section 1. Intro to the cubital fossa, the upper limbs valley. Whenever you're learning anatomy, spatial orientation is literally everything. Notice that overall triangular shape right there at the bend of the elbow. You can see how the muscles of the forearm and the arm converge to create this natural depression, this valley. It's an inverted triangle, which means the broad base is at the top, pointing up towards your shoulder, and the narrow point, the apex, points down towards your wrist. Now here's a great mental hook to help you remember the nature of this space. The cubital fossa is homologous to the popliteal fossa. For those of you who might be familiar with lower limb anatomy, the popliteal fossa is that diamond-shaped hollow located directly behind your knee. Structurally and functionally, the body loves to repeat its best designs. Just as the popliteal fossa serves as a safe transit area for vessels and nerves crossing the knee joint, the cubital fossa does the exact same thing for the front of the elbow. Section 2. Mapping the boundaries, building the walls. I want you to visualize building a fence around that inverted triangle we just looked at. Let's walk through these 4 borders step by step. First, the lateral boundary. This is the outside wall closest to your thumb, and it's formed by the medial border of a muscle called the brachioradialis. Next, our medial boundary, the inside wall closest to your body, is formed by the lateral border of the pronator teres muscle. The base of our triangle, the top wall, isn't actually a muscle at all. It's just an imaginary horizontal line joining the 2 bony bumps on your humerus, called the epicondyles. And finally, the apex at the bottom is simply the meeting point where our lateral and medial muscle walls intersect. You know, what's really interesting is what happens right at that intersection at the bottom. At the apex, these 2 muscles don't just gently touch side by side. No, the brachioradialis muscle actually physically overlaps the pronator teres. It creates this beautifully layered, protective closure at the very bottom of the fossa, guiding the nerves and vessels safely down into the forearm. Section 3. The floor and roof, completing the room. Okay, so we've got our walls. But without a floor, our contents would just fall deep into the joint, and without a roof, they'd be completely exposed. Let's look at the foundation first. The floor of this fossa is not flat. It's a muscular bed, divided into 2 distinct sections. The upper part of the floor is formed by the brachialis muscle, a powerful flexor of the elbow. As we move down into the lower part of the floor, the foundation shifts. Here, it's formed by the supinator muscle, which, true to its name, helps supinate the forearm. Together, they create a soft, muscular trough for our vital structures to rest on. Jumping from the deep foundation all the way up to the roof. You might think the roof is just a simple layer of skin and fat, but it's really not. It houses the highly vital median cubital vein. But even more importantly, sitting just deep to that vein, forming a rigid ceiling over the deeper contents of the fossa, is a fibrous protective shield called the bicipital aponeurosis. Keep this specific structure in mind, because its role is absolutely paramount. Section 4. Vital contents inside, the inhabitants. So our room is completely built now. We have walls, a floor, and a roof. But what actually lives inside the cubital fossa? Well, anatomists love order, and the contents of the cubital fossa follow a very strict, perfectly ordered arrangement. Reading strictly from the medial side, so the inside closest to your body, over to the lateral side, we have three major structures. First, the median nerve. Second, sitting right next to it, the brachial artery. And third, the thick tendon of the biceps brachii. Nerve, artery, tendon. Medial to lateral. It's a precise spatial map that medical professionals memorize and rely on every single day. Section 5. Clinical significance. Venipuncture. We've built the space, we know who lives there, but why does this matter to you and me? Let's connect this textbook anatomy to a routine medical procedure. When you sit in a doctor's chair to give blood, the phlebotomist immediately looks at the bend of your elbow. Why? Because sitting right there in the roof of our anatomical room is the median cubital vein. According to our source material, this is the, quote, most preferred vein for venipuncture in the upper limb. It's the primary target because of its size, its superficial location, and its relative stability. Functionally, this vein is fascinating. It acts as a direct communicating channel, kind of like a bridge across the bend of the elbow. The median cubital vein begins from the cephalic vein on the lateral side, runs obliquely upwards and across the roof of our cubital fossa, and shunts that blood directly into the basilic vein on the medial side. It's a high-traffic superficial highway, making it an incredibly reliable source for drawing blood. But here is where the brilliance of human anatomy truly shines. Think about it. We are poking a sharp needle into a space that houses the median nerve and the brachial artery. Yikes, right? So the crucial point is this, the bicipital aponeurosis. Remember that fibrous layer in the roof we talked about earlier? That aponeurosis acts as a vital safety mechanism. It lies directly beneath the median cubital vein, safely separating that superficial vein from the deep brachial artery and the median nerve. It literally acts like a built-in Kevlar vest for your arm's most critical wiring and plumbing. As we wrap up this explainer, I want to leave you with this final provocative thought. How does visualizing this tiny 3D map prevent disastrous nerve or arterial damage during routine medical care? Every single time a needle enters your arm, the person holding it relies on this exact anatomical blueprint. Because they know the exact boundaries, the precise medial to lateral order of the vital contents, and the hidden protective shield of the aponeurosis, a potentially dangerous procedure becomes completely routine and safe. It just goes to show how understanding the intricate maps of our own bodies is the ultimate foundation for modern medicine. Thank you so much for joining me, and keep exploring.